Welcome back to 5 Talk Street. I'm Chris Gutierrez. February is American Heart Month, the time when our nation focuses on getting our communities involved and learning how to keep ourselves, our families, and friends free from heart disease. And joining me now is Dr. Justin Martin. He's a cardiologist with the Texas Health Fort Worth and the president-elect for the American Heart Association Board of Directors Fort Worth Division. Thank you, doctor, for being here. We have to start from the very beginning. How common is cardiovascular disease?
So heart disease is very, very common. We know that studies tell us that about half of adult Americans have some form of cardiovascular disease. Cardiovascular disease is clearly associated with specific risk factors such as high blood pressure, diabetes, cholesterol, and smoking. But we also know that a significant number of people who don't seem that they have a lot of risk factors may have heart disease hiding in them. And that's why it's important that they get in with their doctor to discuss their individual risk. And certainly if they have symptoms that are uncertain or concerning to them, that they should seek medical attention.
You know, I'm reading here that, we're talking about everything from heart disease, heart attack, stroke, heart failure. It kind of runs the gamut. How do we prevent that?
Well, as I mentioned, heart disease really is very preventable. We know that the majority of heart events can be preventable, and it really rests on getting an individualized risk assessment with your doctor and understanding what is your risk. Do you have high blood pressure? Do you have diabetes? What is your cholesterol? What should your cholesterol be? Do you smoke? Remember, it's never too late to quit smoking. And then understanding other lifestyle habits like your exercise, your proper body weight, that sort of thing. And then there's other enhancing risk factors that we want to think about, particularly in our female patients. Do they have complications with their pregnancy, such as diabetes, or a condition called preeclampsia, hypertension during pregnancy, that can enhance their risk? There's some patients that, despite looking at all those things, we're still uncertain, and they may be benefited by having more advanced testing, like a specific heart scan, to look for evidence of early disease that may enable them to get early detection and treatment.
We hear a lot about diet, exercise, healthy lifestyle. Is there a specific time? Should we be on a treadmill for so long? Should we be eating certain foods? Is there kind of this magic number out there?
Well, clearly most cardiologists will tell you eat mostly plants and eat less, okay? So we really
want to... this is Texas, right? We like our red meat.
Right. We really want to, look at our diet and try to increase the amounts of fruits and vegetables that we're eating, increasing the amounts of fish that we're eating, increasing the amounts of grains and nuts. And when it comes to exercise, really the American Heart Association recommends 30 minutes, 5 days a week of exercise. Remember, some is better than none.
Absolutely. When it comes to symptoms, does that differ between men and women? Do you see anything like that?
Well, that's one of the big, public health messages that the American Heart Association wants to get out this month, is that we know that women and men may experience heart disease in different ways. Men may more often experience heaviness in the chest and the classic going into the arm, et cetera. Whereas about 30% of women who present with heart attacks may have no chest pain at all or chest discomfort at all. They may have jaw pain or throat discomfort or shoulder discomfort or only indigestion or new shortness of breath for them.
The #1 killer of Americans.
Yes, and unfortunately that's been the case for the last 100 years. And it's not only the #1 killer for men, it's the #1 killer of women. And so a lot of women don't really understand that. And so we really want to have a lower index of suspicion in terms of evaluating our patients who are females for their risk and then being more aggressive with their treatment.
Do you think the vast majority of Americans realize that? Again, we hear it all the time, and we can say it till we're blue in the face. Exercise, you have to exercise, you have to eat better. But then when you see a statistic like that, you're like, holy cow, is the message getting through?
I think it slowly is. I just think it's very important for individuals to understand their risk factors. Really understand what your cholesterol is, what your blood pressure is. The American Heart Association has, and studies have shown lower blood pressure is better. We're now shooting for a blood pressure goal of 120/80 or less, where in the past we went for higher goals. So it's really important to get with your doctor to understand that.
Gotcha. For much more information, we want to make sure that you can learn more on how to protect your heart from heart disease. Just visit heart.org. Thank you, doctor, for being here.
Thank you.
Stay with us. We'll be right back with more of 5 Talk Street right after this.